All right, welcome to Dental Anatomy Review 2. So far we have reviews on primary dentition, the stages of development, discussed some enamel, dentin, pulp, some of the high-yield material that you're supposed to know. This series of lectures that are going to continue, we're going to discuss the Spee, Wilson, the height of contours, the interproximal space, and then from there we're going to start discussing the teeth themselves. Okay, so the video which you will be following after this one is going to be the anatomy of teeth. Okay, all right. So let's discuss about classification of dentition. Okay, so different classification of dentition. There's a heterodont. Okay, a heterodont is dentition in which there are different types of teeth to perform different function in the mastication process. For example, of a heterodont is the human dentition. Homodont is dentition in which all the teeth are the same in form and type. Okay, some of the lower vertebrae have are homodonts. Okay, but humans are heterodonts because we have different type of teeth. We have canines, we have incisors, we have molars. Okay, the polyphyodont, okay, or polyphyodont. These are species which have more than two, okay, or sets of teeth, or they have continuous set of teeth that are developed throughout life. Okay, some of the polyphyodonts are what you call the rodents, such as rats. Sometimes the rats, the teeth, they become so long and they continue to grow throughout life. Okay, monophyodont, they are species, okay, with one set of teeth during life. Diphyodont, okay, these are species with two separate sets of teeth or dentition. Diphyodonts, for example, humans we have two sets. We have primary dentition and we have permanent dentition. So we'll go under diphyodonts. Diphyodonts, and also remember we discussed that heterodonts. Okay, human are also heterodonts. Okay. Dental formula, we discussed already the primary dentition formula. This one also includes some of the permanent dentition formula. You're supposed to know these formulas. You cannot go in the exam without knowing the formulas. Find a way to memorize it. It's very easy when you know how the formula is made. Okay. So a dental formula describes the dentition on one side of the mouth as to the number and type of teeth. Dental formula for the permanent dentition is as follows. You have the incisors. You have two incisors on the right side on the maxilla, and you have two incisors on the lower side in the mandible. You have one canine on the upper, one canine on the lower. You have premolars, two premolars on top, two premolars on the lower. That's on the right side. And we have three molars, okay, on one side, 3 and 3 on the lower. And then you multiply by 2, you get 32. That's why here you get the formula, okay. For primary dentition formula, which we discussed already, it's the same as it's almost the same as the permanent dentition, except there's no premolars and the number of molars is reduced by 1. So instead of M3, you have M2. Okay? And so primary dentition has a total of 20 teeth. The curve of Spee. The curve of Spee, okay, is the anterior posterior curve or curvature, which begins at the canines, and follows the buccal cusp tips of the premolars and molars. The curve of Spee curves upward from the anterior to posterior and is best viewed from the facial aspect, as you can see in the picture above. Okay. And based on the curve of Spee, the crowns of molars tilt towards the mesial. Okay. As you can see in the picture above, the molars, for example, the one you're looking at, number 17, 18, okay, you can see that they are slanted towards the mesial aspect. So based on the curve of Spee, the crowns of molars tilt towards the mesial and their roots towards the distal. The premolars are the most upright and vertical teeth in the dental arch. As you can see from this picture above, you can see that the premolars are almost perpendicular, okay, to that curve. So very high-heeled here, okay. The premolars are the most upright vertical teeth in the dental arches. The maxillary central incisors are the teeth which are least perpendicular to the plane of occlusion, okay. The crowns of the maxillary central incisors tilt to the labial. So the teeth with the most axial inclination in the mouth are the maxillary central incisors, because they are more tilted labially. Okay, very high heel slide. Make sure you know everything on this slide. Okay, the curve of Wilson. Okay, because of the curve of Wilson, the crowns. Okay, so because of the curve of Spee, the crowns of molars, they tilt mesially. Because of the curve of Wilson, the crowns of mandibular molars, they tilt lingually, and their roots tilt to the buccal. This principle is very important in understanding occlusion. There's a lot of questions about this, how the teeth occlude. So you have to know that there's always a tilting, lingual tilting of the crowns of mandibular molars. Okay, and the crowns of maxillary molars, they tilt buccal, and the roots tilt to the lingual. Okay, keep that in mind. So the compensating occlusal curvature is the three-dimensional curvature of the occlusal plane, which is a combination of the curve of Spee and the curve of Wilson. The synonym for compensating occlusal curvature is the sphere of Monson. And this curvature, the compensating occlusal curvature, is a concave, okay? It is a concave in the mandibular arch and convex for the maxillary arch, okay? All right, height of contours. A lot of high-heeled stuff here. The things that you're really supposed to know. Height of contours, make sure you know them really well, okay? So the height of contour, or the crest of contour, is the greatest area of contour incisor or occlusal cervically on the facial and lingual surfaces of teeth. The mesial and distal surfaces also have heights of contour, and they are located at the contact areas. Okay, so the mesial and distal height of contours usually are in the contact areas. Now we're going to discuss more of the facial and lingual height of contours. Okay, so number one, the facial height of contour of all teeth is located in the cervical third. Okay, the facial height of contour of all teeth is located in the cervical third. As you can see in the picture above, number one, okay, in the facial aspect. So you can see that this is a maxillary molar because it has three roots. And so That's you have a palatal root, and you have also two buccal roots. And so you can see that where the arrow is pointing, the facial height of contour is in the cervical third. Okay, so the facial height of contour of all teeth is located in the cervical third. When somebody asks, what is the facial height of contour of this tooth? Just know it's cervical third. Okay. The lingual height of contour of all anterior teeth is also located in the cervical third. This is because of the cingulum. Somebody asks, what is the lingual height of contour of tooth number 9? It's in the cervical third. Where is the facial height of contour of tooth number 9? The cervical third, because it's an anterior tooth. Okay? Because remember, the facial height of contour of all teeth is in the cervical third, and the lingual height of contour of the anterior teeth is in the cervical third. Now, the lingual height of contour of all posterior teeth is located in the middle third, except, okay, wherever there's an exception, always pay attention, we'll accept the mandibular second premolar, which is in the occlusal third, as you can see in the picture. Okay, very important slide here. Make sure you know it well. The crown surface form, okay. In the previous videos that I've made, you can see there's some questions which ask, when viewed from the facial, what is the shape of a crown? When viewed from the proximal, what is the shape of the crown? When viewed from the occlusal, what is the shape of the crown? So you have to know the shape of the crowns, okay? Viewed from the facial and lingual surfaces, also viewed from the occlusal surfaces. From the facial and lingual aspects, the crowns of all permanent teeth can be described as trapezoid in shape, okay? When you view from the facial and lingual aspect, the crowns of all permanent teeth is trapezoidal in shape. Just like in the picture, it's a trapezoid, okay? Facial lingual, the shape is trapezoidal. The incisor and the occlusal side forms, okay? The incisor and the occlusal sides form the base of the trapezoid, okay? When they ask, okay, the shape is a trapezoid, where is the base? The base is at the incisor or occlusal side, while the cervical represents the shorter parallel side. Arrangement of this trapezoid, okay? So now remember, when you look at the teeth, the crowns of the teeth in the facial and lingual surface, they form trapezoid. When you put these trapezoids together, now because they are not completely parallel, so they're going to form triangles in between them. Those triangles in between are called embrasures, okay? So arrangement of these trapezoid shaped crowns side by side in the dental arches creates interproximal spaces between the teeth and one contact area between each pair of adjacent teeth, okay? Now, the interproximal space is the triangular shaped area between the adjacent teeth that is cervical to the contact area. So interproximal space is cervical to a contact area. The interproximal space is usually filled with gingival tissue known as interdental papilla, okay? You can see a picture here. So number 1 is going to be the alveolar mucosa. Number 2 is marginal gingiva. Number 3 is gingival line. Number 3 is interdental papilla. Number 5 is gingival embrasure. And number 6 is the contact area. Number 7 is the clinical crown. And number 8 is incisor, occlusal, embrasure. Okay, so you have two embrasures, above the contact and below the contact. Okay, so incisor or occlusal embrasure. Number 9 is anatomical crown. And number 10 is interproximal space. Number 11 represents the cervical line, or the CEJ. And then number 12, you have alveolar process, and then you have number 13 as alveolar bone. So make sure you know the anatomy of the interproximal space, okay, and what makes the interproximal space, the components, the embrasures. Now remember that you have an occlusal or incisor embrasure, and also you have a gingival embrasure. The triangle, so the triangle of the interproximal space is formed by, number 1, alveolar bone at its cervical base. Okay, so in the interproximal space is a triangle. What makes the base of the triangle of the interproximal space is the alveolar bone. Number 2, the proximal surfaces of the adjacent teeth on each side. Okay, and the contact area of the adjacent teeth at the apex. So the apex of the interproximal space triangle is the contact area. The base of the interproximal triangle is the alveolar bone, and the sides of the interproximal space triangle are the adjacent teeth. Okay? So the general rules of contact areas, number 1 rule, you have contact areas become more cervically located from the anterior to posterior in each quadrant. Okay, so contact area, as you progress from the anterior to posterior, as you can see in the picture below here, it's a slanting line. Okay, so it progresses from the occlusal almost to the cervical or middle third. Okay, so the distal contact areas of a tooth normally has more cervical location than the mesial contact area. That's why when you're doing a tooth identification, you can look at an extracted tooth, you look at it, and just based on that slanting of the tooth, you can tell which one is distal, which one is mesial. Okay, that's because the mesial contact area is usually, or the mesial contact area, or the mesial height of contour is a little bit more occlusally located compared to the distal height of contour, or the contact area. And the relative size of the contact areas increases from the anterior to posterior in each quadrant. Okay, so the relative size of the contact areas increases from the anterior to posterior. So meaning the posterior teeth have wider contact areas compared to the anterior teeth. All right, very high-heeled material. All these lectures are very high-heeled, the things that you're supposed to know. All right. General rule number 4. Anterior teeth have contact areas that are centered in the facial-lingual dimension. Okay? Anterior teeth have the contact areas which are right in the middle of the facial-lingual dimension. Rule number 5, you have to know that the posterior teeth have contact areas that are normally located to the buccal of the center in the facial-lingual dimension. So the anterior teeth have contact areas which are centered in the facial-lingual dimension. The posterior teeth have the contact areas which are a little bit more to the buccal, okay, compared to the in the facial-lingual dimension compared to the anterior teeth. So it means that the lingual embrasures are going to be a little bit wider than the facial embrasures in the posterior teeth. cervical line curvatures. So the cervical line curvature or the cemento enamel junction is defined as the observable line around the tooth where the cementum and enamel meet. The cervical line is a stable entity, okay? Meaning the CEJ is a stable entity. It doesn't change. In contrast to the gingival line, so CEJ doesn't change. However, the gingival line changes because of recession, inflammation, all those who are going to change the gingival line, but the CEJ does not change. Okay, keep that in mind. On any individual tooth, the amount or the depth of the curvature of the cervical line, the CEJ, seems to be related to, number one, the width and length of the crown. Number two, it's also related to the location of the contact areas proximally. Okay, so let's look at more of the rules on the cervical line of contours or the CEJ. Okay, so if you look at the images, you can see the different forms. Okay, so rule number one of the cervical line contour is that the cervical line is normally curved or convex. Okay, cervical line is curved or convex towards the apical on the facial and lingual surfaces. Okay, so the CEJ, in the CEJ, when you look at the teeth in the facial lingual, the CEJ is going to be curved towards the apex. Okay. However, when you look in the interproximal, okay, in the mesiodistal, the cervical line or the CEJ is normally going to be curved towards the incisor. Okay, as you can see in the picture here on the right side, you can see that the CEJ is curved towards the incisor or the occlusal surface. Okay, very key important anatomy to note. Also, rule number three, the amount or depth of the curvature on any tooth is normally greater in the mesial surface than the distal. So the CEJ has more contour on the mesial than on the distal surface. Rule number four, the CEJ on each adjacent proximal surface, okay, on adjacent tooth has approximately the same depth of curvature. Rule number five, the depth of curvature of the CEJ of all surfaces is greatest on the central incisors and decreases posteriorly. Okay, so the curvature of the CEJ decreases as you progress from the anterior to posterior. Lobes, okay, of anterior teeth. You have to know the developmental lobes. All right. So anterior teeth, even though they have 3 mamelons, they develop from 4 lobes. They have 1, 2, 3, 4 lobes. Okay. Number 1 is the distal labial lobe, the middle labial lobe, mesiolabial lobe, and the lingual lobe. The cingulum develops from the lingual lobe. Anterior teeth are composed of 4 lobes. The 3 labial lobes are named the mesiolabial, middle labial, and the distal labial. The remaining lobe is named the lingual lobe and encompasses the cingulum. All right, make sure you know lobes really well. Okay, these are 3 points that you're supposed to get. So the lobes on the premolars. The lobes of the premolars are named are named similar to the lobes of in the molars, but they also you have Most premolars are exhibiting 4 lobes, okay? They have 3 buccal lobes and 1 lingual lobe. So it's the premolars almost the same as the anterior teeth lobes, okay? So 3 buccal lobes or 3 facial lobes and 1 lingual lobe. And they are named the mesiobuccal, the middle buccal, and the distal buccal lobes, as you can see in the pictures above. Okay. So the exception of the lobes, okay, is the mandibular second premolar with 2 lingual cusps. All right. So this is the Y type mandibular second premolar. You can see the Y type mandibular second premolar has 5 lobes. Okay. Mandibular second premolar Y type has 5 lobes. So it has 5 lobes, 3 buccal and 2 lingual. The lingual lobes are named the mesiolingual and the distal lingual lobes. Okay. Always when there's an exception, you have to make sure you pay attention. All right. Something to memorize. High-heeled stuff. Okay, so the lobes on the molars. Maxillary molars normally have 4 lobes, which are named as mesiobuccal, the distal buccal, the mesiolingual, and the distal lingual lobes. Okay, the evidence of lobe separation can be found in the central, buccal, and the distal lingual grooves. The facial developmental depressions are not found like on the anterior teeth and the premolars. Okay. So the mandibular first molars normally have 5 cusps and 5 lobes. Okay. So let's look at what has 5 lobes. 5 lobes is the Y-type mandibular second premolar and also the mandibular first molar. They have 5 lobes. Okay. The 5 lobes of the mandibular first molar are named just like the lobes of the maxillary molars. You have the mesiobuccal, the distal buccal lobe, the distal lobe, the mesiolingual lobe, and the distal lingual lobe. The lobe of the 5th cusp is named the distal lobe. Okay. Most other mandibular molars exhibit 4 cusps and 4 lobes, with the terminology the same as the maxillary molars. So you have, let's look at the lobes. So you have all teeth, okay, develop from 4 lobes, except the mandibular first molars and the mandibular second premolars, Y type. Okay. Other type of mandibular premolars, second premolars like the U type, the H type, those ones they develop from 4 lobes, but the Y type develops from 5 lobes. Okay. Make sure that you know these exceptions. Okay. Okay.